Hello and good afternoon. Thank you for joining us today. My name is Midra Surratt. I'm the Executive Director of Parent Information Center of Delaware. And PIC is a statewide nonprofit organization that supports families of children with disabilities or special health care needs. And our mission is to improve health and educational outcomes for children and youth by empowering them, their families, and the professionals who serve them. Recently, Delaware merged, the Parent Information Center of Delaware merged with Delaware Family Voices. And as such, we are providing information and support to families through webinars and trainings. And today we're so happy to have Eric Gonzalez with Highmark Health Options to talk about the benefits of care coordination. So I want to turn this over to Eric. Eric, thank you and welcome.
And thank you for having me, and thank you for everyone joining the webinar. Hopefully we'll be able to help everyone understand some of the benefits of the care coordination programs that both MCOs here in Delaware have, and how we can assist parents with their children with special needs, and see that we're here to help, and hopefully you can learn something today. So again, my name is Eric Gonzalez. I'm a manager here, one of the managers in care coordination here at Highmark Health Options. And one thing that the question that always comes up is, what exactly is care coordination? And we really think about healthcare is in general is really complicated. And a care coordinator's job is really to help families with trying to navigate the system. So it's a service provided by Delaware's managed care organizations to assist Medicaid recipients with navigating the healthcare system, making appointments, finding needed health services, and finding community resources. And these are all bullet points that we're going to go over in our presentation today. And a care coordinator, you can hear different names depending on which state you live in and what type of healthcare entity you're working with. Some MCOs may call them case managers. In Delaware, for the non-LTSS population, they're care coordinators. If you have if you're a parent of someone with an LTSS benefit, they're called a case manager. In hospitals, a lot of times they'll call them navigators. New Moors has a great care coordination program, and they're called clinical care coordinators, and we work really closely with them. So you'll hear a lot of different names, but they all mean the same thing. It's really to help a patient, a recipient, a member navigate the healthcare system. And when we're thinking about navigating the healthcare system, we can really I tried to find the messiest slide that I could. And I felt like this really represented what happens in healthcare here in America. When we look at the center of this, we see there's a whole bunch of different paths to get to one place. And in the center of it, you think about your doctor's appointments, medications, and getting those medications on time, emergency room visits, blood work, and that's just for their medical needs of a child with special needs. But then you look more outside of that center area, and to the right, you see a shopping cart. So you think about social needs related to, is there enough food in the home? You're thinking about financial needs of a family. And then, you look on the left-hand side, and sorry about the dogs. You look on the left-hand side, you see, up top, you think about a blog, the internet, so many resources on the internet. What's a good resource? What's a bad resource on the internet? And then alternative medicine that a parent may want to use in support of traditional medicine, cultural beliefs. There's so much that's involved in the care of a child with complex needs, and that's just their needs. You add the needs of as a parent, caregiver burnout is a real thing. So, really looking at the whole person, the whole family, when we're thinking about navigating the healthcare system. And that's where a care coordinator can really come in to help to lend a hand. Prior to me working at Health Options, I was a navigator for a cancer center. And the one thing I always used to tell my patients was like, you're going through enough. My job is to, when there's a roadblock, to help move that roadblock so that you can continue on, your path to treatment or path to receiving the services that that you need. So this is definitely an area that we can help with our care coordination program. And it's our goal is to really assist in the families in getting the services that are medically necessary, and also helping when services might not be covered with Medicaid, looking at community resources that might be able to help with different things like that. So one of the first areas that we look at is appointment linkage. And you're going to see through the slides, I use CC and RC. So a CC is a care coordinator, a RC is a resource coordinator. Now, what's the difference? Well, a CC is a licensed professional. So you're talking about a registered nurse or a licensed social worker. Whereas a resource coordinator is non-licensed, but they can assist with at one-time call. You know, I use an example of someone moving to Delaware and they need a new PCP. The research coordinator can help, you know, set you up with a PCP or provide you a list of PCPs in the area that you live in that's accepting new patients. So that more low-level type of issues that come up, where a care coordinator is really going to help work with a member or a child that has chronic illness that needs long-term support. So both CC and RCs can assist with making appointments. If an appointment is scheduled and it's for a specialist and it's 3-4 months down the line and there's a need now, you know, the RC or the CC can assist with speaking with that provider to try to see if we can find a sooner appointment. Or if not, you know, we can look into other providers in that same specialty that might be able to see you or your child sooner. So assisting with that. And another important thing is following up with the member to ensure that the appointments did take place. So if you're speaking to your care coordinator and you say that you have your PCP appointment for your child this week, you know, we're going to follow up the following week to see, hey, did anything come up from that appointment that you need help navigating or help getting assistance with? Were there any new prescriptions or things like that? So again, just not just helping set up things, but going through with the follow through to assist as things are needed. And also finding needed services. And I feel like this is where a care coordinator is the most useful, especially when you need home or outpatient services. You know, we even can assist with finding inpatient services. You know, there might be the one doctor that does a special type of transplant that they only do at Johns Hopkins. The care coordinator can work with your doctors here in Delaware, your doctors at Johns Hopkins, to make sure that the out-of-network authorization is in place, things like that. So we can definitely assist with that, assist with getting connected to home care services, anything from, you know, home PT, physical therapy, occupational therapy, to private duty nursing, and helping you and your family find the appropriate outpatient services or specialists, and just making sure that you get those services that your child needs, and help navigate through that process. If an authorization is needed, you know, helping educate parents on what that process looks like for authorization. Working with the doctor's office and our internal utilization management team to make sure that everyone has the most updated and most appropriate information so that, you know, decisions about the authorizations can be made. And also following up again when those services, that those services were delivered. So if you're supposed to get a piece of DME equipment and it's supposed to come today, you know, we want to make sure that we're following up with you today or tomorrow to make sure it was received. And if not, working with the DME provider to figure out, you know, what went wrong and what needs to happen. And that's something that I know when I was first a care coordinator, I learned that lesson of how important our job is. And I always like to share this story. So 7 years ago, when I was new to Health Options, I had a complex child with a lot of different needs. And mom had reached out to me looking for a new DME provider for formula. So I made a couple calls, found the DME provider. I gave mom the number. And that was it. I cleaned my hands of it at that point. A week later, on a Friday afternoon, mom called and said, I don't have enough formula for the weekend. I never had the opportunity to call that new DME provider. So my first thought at that time as a new care coordinator was, well, wait, I gave mom the number. But then I paused and really thought about it. This was a single mom that had a very complex child with a lot of different needs, also had other siblings in the home that she was responsible for taking care of. And this particular mom was trying to run a business out of her home. So it really made me think about, my job isn't just to provide information. My job is to really assist. If I would have made the call to the doctor's office to get the new prescription to make sure it got sent to the DME provider, mom would have never had to call that Friday. Thankfully in this case, we were able to make a bunch of calls on Friday afternoon and everything got delivered overnight, and the member wasn't affected. But it taught me a lesson that I continue to teach all the care coordinators that are under me about the importance of, we're not just here to provide information. We're here to assist our members, and especially our parents, in any way we can to help lift the burden however we can when it comes to trying to navigate that craziness that we saw in that first slide. And that's where our partnerships really come in handy, especially with our children with Nemours. They have a great care coordination program. And now over the last couple of years, they've grown to a point that every one of their offices has their own care coordinator. And we have that list. We know who's our go-to person for each office. So that really is helpful. And another example of this, a child that might be newly diagnosed with type 1 diabetes, and they go to an endocrinologist at Nemours. We'll follow up with the social worker in that department to say, okay, they're new. What things were set up for them? What can we do from our side to help with any roadblocks, or finding the DME provider that has the right pump that they need and things like that. So again, our goal here is to assist with any way that we can, especially assisting our parents. And then, there are some things that just aren't covered by Medicaid. And when that happens, it's, working with community resources to figure out ways to get different, it could be items covered or funded. Or going back to that original picture when food insecurity becomes an issue. We both MCOs have a community repository on our website, basically a library. So our CCs and RCs, or even anyone out in the community, can go onto our website and look for food pantries that are in the area of where you live at. And there's a lot of different resources, even with assisting with paying for an electric bill. I remember times that I've had to call the water company for a complex child and say, hey, what can we do to make sure the water doesn't get turned off? What kind of community resources are out there to help with making a payment, or just begging them to keep the lights on for a little bit longer. So again, those are different things that a care coordinator can and does assist with. You might not think, well, wait a minute, you guys are just the health insurance. We're that, but we're also here to assist any way we can. And that's where this community repository really comes in handy. And so we can make referrals directly to these community-based organizations. And again, we're big on follow-up. So when we make those referrals, following up that, if we were mailing you a bunch of resources, that they were received. If you need assistance with making the calls, doing a three-way call with any of those community resources, we're here to help do that. And just really looking at what's out there that can benefit your child and you as a family when navigating the healthcare system. And then, the question always comes up, and I've heard, parents on our different calls, say that I've known many families that weren't even aware that they could have a care coordinator. So, when you hear that out in the community, how can a family be referred to a care coordinator at one of the MCOs? One way is looking at the back of your ID card, your insurance card. There's a number there for member services, or it might be called customer service. You call them, and then you can ask for a care coordinator to be assigned to your child. Physicians make referrals over to us as well. So we've gotten referrals from physicians. We've gotten referrals from Family Voices before. So, you know, any community entity can submit a referral, or a parent can just call up themselves. Internally, we have some systems in place to automatically assign members and children to care coordinators. So for example, if a member has private duty nursing, as soon as that initial request comes in, they're automatically assigned to someone. We also look at certain diagnoses and a combination of hospitalizations, emergency room visits, and we'll get a list of members that our system will recommend that we should follow up because they might be at high risk and may need a care coordinator. So, you know, this was a high level overview of our program. I'm more of a question and answer type of presenter. So, you know, if anyone definitely has any questions, you can definitely ask. But it is a program that both MCOs have. To even go deeper, it's a program where the federal government requires each state Medicaid plan to provide some type of case management program. So that's where the MCOs come into play here in Delaware to provide those services to the Medicaid recipients.
Thanks, Eric. There was a question regarding the PowerPoint, if that would be available to participants afterwards. We'll make sure that that will be sent to the participants afterwards. So yes. And I did have a follow-up question. Is it possible in some circumstances where a family may have both a resource coordinator and a care coordinator, or would the care coordinator take on the role of the resource coordinator?
Right. So many times, and I can speak about health options, when we receive anyone a referral, they'll be assigned to a resource coordinator sometimes to assess the needs, but they have they do their own type of screener, and based off of that, we'll upgrade the member to what we call level 2, which is a care coordinator. So you'll never have a care coordinator and a resource coordinator at the same time, but through your process, you could have both. You could start off with a resource coordinator and move up to a care coordinator, or vice versa. You could have a care coordinator and use that example of a new diabetic, and everything's going well and stable, but there's still some needs that you may have. You may, you know, downgrade to a resource coordinator if there's just one more thing to close the loop on, something like that. But for the most part, you'll be assigned a care coordinator.
Great, thanks. And we also want to open this up. We have some time. If you have any questions, feel free to utilize the chat, or you can unmute yourself to ask a question. And if not, we'll give it a few minutes to see if anyone has any questions. And if not, please know that you can always contact our office, 302-999-7394, or you can go to our website. Looks like there is a question. For Meals on Wheels, MCO for Meals on Wheels supplies, information and resources to seniors. How would an MCO assist with DME contacts?
Yeah, so 2 parts just to clarify. So Meals on Wheels is a program that benefits our LTSS population, which, you know, seniors do qualify for that depending on their needs. But when it comes to any DME contacts, MCO, we can definitely help, you know, just calling member services, asking for care coordination referral, and they can assist with any contacts that are needed with a DME provider. I hope that answers the question. Or Michelle, if you want to, you know, clarify exactly what you're looking for. But when in doubt, and one thing I always tell families, when in doubt, just call your care coordinator. Anytime you run into any type of roadblock, don't try to deal with it. Just give us a call, and we'll make the phone calls that we need to make sure that, you know, we remove any of those barriers.
Thanks, Eric. It looks like you might have answered Michelle's question. But again, Michelle, you can certainly reach out to either of us if you have a follow-up question regarding that. Also, just wanted to remind everyone that next week we will be hosting part 2 of this series on around Medicaid. And I just wanted to also apologize again because there was the title for this presentation was incorrectly advertised. This was the benefits of care coordination, and it was not advertised that way. So just wanted to clarify that as well. This is being recorded and will be posted on our website and available for you to review afterwards. Please take a few moments to complete the survey that you'll receive immediately following the webinar. And again, as always, oh, hold on. She did have some follow-up questions. So I'm not sure if you saw, Eric, some DME are not covered under contract with health options. Where would you find resources in the community?
Yeah, so if you find, so DME is not covered under contract with health options, I mean, it definitely depends on the type of DME, because there's some DME items that, you know, it really comes down to if a DME provider can bill for it. So that can go a lot of different ways. So if it's a true piece of medical equipment that a normal DME provider carries, and let's say that DME provider is not in network with health options, once that piece of equipment is approved, we do something called a single case agreement with that non-network DME provider to make sure that DME can get to the member. There are some, I see this a lot with some unique specialty beds where you won't find a DME provider in the country that actually carries the bed. You know, only the manufacturer sells the bed. So, you know, things like that would be where we'll look at community resources to try to see if there's any funding out there for those type of things. Or we look to see if there's a comparable like specialty bed or piece of DME equipment that does the same thing that is found within a DME provider versus not being sold directly from a manufacturer. So sometimes, you know, those type of things do happen, and we keep working at it until we can come to some type of solution.
Great. Well, Eric, thank you so much for taking the time to join us today and for this information, which is very useful and will be helpful, I know, to many families. Again, at the conclusion of the webinar, please take a few moments to complete the survey, and that you can always reach out to our office if you have any follow-up questions and or concerns. And keep an eye out in your email for a copy of the presentation. Thank you again, Eric, and thank you for joining us today.
Thank you for having me.